Should we get a smoke tunnel in the whole nine?
Okay, everybody, thanks for joining us here at Big D's today. If you didn't get the chance to sign up for that text message code, Belinda has a sign right over here. You're welcome to do so when this seminar is over. But please join me first in welcoming Dr. Vicky Johnson here with us today to speak on one of our biggest fears, equine colic, right? So I appreciate the turnout, and it's all yours.
Thank you. Can everybody hear me okay? I'll try, if I see the eyes glaze over in the back, I'll yell louder or just like wave or something. So whenever we, like every year, Belinda emails me and she says, we're going to do some talks. What do you want to talk on? And I always kind of sit there and think, like, what do I get the most questions, phone calls, whatever about? And obviously colic is a hot topic. How many people here have ever had a horse colic? Okay, turn and look around. Everyone, right? It's very common, unfortunately, and we all know it can go on a side of the scale from severe to mild. So what I thought I'd do today is kind of give you, if you will, a peek behind the curtain or maybe the abdomen and let you kind of in on what we deal with and what we see and kind of what our goals are when we see a horse that's colicking to help you guys make the best decisions, to give your horse the best outcome. And eventually, at the end of the talk, I'm going to go over just a couple of things that we advocate for to help prevent colic, because that's the million-dollar question, right? So I will put a little disclaimer out there. I did my vet school at Ohio State. Obviously, they do a lot of colic surgery there. And then I did a one-year internship after I graduated at a practice called Rood and Riddle, which I'm sure most of you have heard of at some point. So a lot of the pictures I have are of colic surgery, which means there are guts and there is blood. So I'll just warn you, if you're a little squeamish, I'll try, if I remember that something's coming up, to just warn you that a picture's coming. But unfortunately, when it comes to the GI tract, it's a lot of tubes and a lot of schmoo in one place, and so the best place to see it is to take it outside of that. So here we go on the heavy stuff. I wanted to start with just a brief kind of asterisk behind this whole talk, which is the word colic itself. To me as a veterinarian, the word colic is potentially the most irritating word that I hear spoken any day, because it really doesn't tell you anything, right? We're going to go over what the clinical signs of colic are, but they're super generic, and all colic means to me is that the horse is exhibiting some degree of pain. And horses, because they don't speak English, speak in other ways, like pawing and rolling and looking at their sides and lifting their lip up. So the word colic, most of us here can attribute that to true GI pain, but the reality is that a horse can colic for multiple reasons. So while I was making this talk, I thought to myself, how many emergency calls have I gotten where someone said the horse is colicking and it's been something else? And I compiled this very short list of things that have presented that look like colic. So horses that are choking will colic. Horses that are foundering can colic because they are just so painful. They're like, I don't know what's happening, so I'm just going to tell everybody I don't feel good. I've had a horse with pneumonia act colicky because, again, the only language they know to speak is behavior. And so they'll straight up just say, this is all I know to tell you. Tying up or muscle spasms, horses with diarrhea, gastric ulcers. I've had a horse that came off of a jump, tore one of the muscles in his back leg and started acting colicky. Again, not because his GI tract hurts, but because he's just trying to talk to his people. So it's a really long list. And the reality is, if you guys call like Cleveland Equine After Hours, you get a lovely group of people who know nothing about horses. And so you're in charge of telling them what's wrong, and then they just call me and say, this is what they said. So for most people, the word colic is fine. You've just described in one word a lot of clinical signs that the horse is telling you. And even if you didn't necessarily diagnose the horse, it at least gives us a place to start. So I just wanted to point that out, that you're never wrong to say a horse is colicking, but it may not be just the GI tract. So common signs of colic, or clinical signs. I'm sure all of you at some point have experienced this, and hopefully you don't experience it anytime soon, but there's a long list of things. So the most common ones that I think people know are pretty obvious, right? The horses are pawing, they're off their feet or grain. One of the more common things I get is like the horse walks over to the hay and like noses through it, but then he walks away. Same thing with the water bucket. We call this picture here flank watching. So the horse is turning to look at their flanks, and sometimes they'll just stare at it, sometimes they'll nip at it, sometimes they'll swing their head back and forth. One of the things I wanted to point out, because this is probably my favorite like little myth to dispel, is this picture here. This is a 4-year-old warm blood. It's not a saddlebred, it's not a Tennessee Walker. Those breeds, warm bloods, do not know how to park out like show horses. So the number one call I get with that is my horse is trying to pee, but he's not peeing. And I have to explain to them, like, it's not that your horse is trying to urinate, it's that he has abdominal pain. So how many of you guys, Thanksgiving time, you finish dinner and you go, ah, you know, you stretch your abdominal muscles? Horses will do the same thing. So they park out and stand really wide base because they're essentially trying to alleviate some of the pain in their abdomen. Another one, I took this picture. This horse is actually going to colic surgery. Sorry for those in the back. But we call this the double bubble. So you can see the line where the chest ends and all of a sudden the abdomen has a really big contour. Horses can, if their colon gets full with enough gas, actually bloat. And a lot of people, when they start to look at the horse, they're like, I don't remember them having that much fill. So bloat is another symptom of colic if their colon's really filling up. And then last but not least, luckily this is a very uncommon one, but I pointed out, is some nasal discharge. All right. We're going to talk about the old age adage of horses can't vomit here in the middle of my talk, but sometimes you can actually see if there's enough stuff backing up into their stomach, gastric contents can leak out their nose. Obviously, that can also be a sign of what else? Who wants to be brave? Choke. Yeah. So again, on our list of differentials, that's all what that is. A list of differentials is essentially what are my options of what this could be, and then our job is to try to figure out, and looking at the horse, which one of those things are more likely than another. But nasal discharge we'll see sometimes. So what to do if your horse is colicky? If you've owned horses for a long time, you probably have got this list down pat, but for those of you that are joining in, maybe just learning some new things, I'll give you my quick and dirty what to do. So number one is remove all of your horse's food, hay and grain. In most situations, I don't mind if the horses have access to water. About the only time I have people pull water is if the horse is choking, because nothing's going down. Otherwise, ask whoever you're calling. If that's your barn owner who's standing there with you, if you're calling the vet, just ask. I tell people there are no stupid questions. On my front, there are only stupid answers, which I try not to give out too frequently. Walking. If you guys have ever been in a care facility yourself, personally, like hospitalized, the care team for humans, and we know this, whether it's humans, dogs, cats, whatever, walking helps stimulate your parasympathetic nervous system, which means it's going to stimulate all of your GI tract to keep moving. The other purpose it serves, do any of you guys have real busybody horses that they're just like, whoa, what's over here? What's happening? Sometimes walking them distracts them. The fact that their tummy kind of hurts. So for some horses, if they're just working through a mild colic and you're trying to get their mind off of things, I'll say just take them out and do some hot laps in the arena and get their mind thinking of other things. When I tell people the critical time to call, there's kind of two benchmarks. And I will preface this with, you are never wrong to call your vet. I would much rather talk to you at any point in the day than when things have officially like gone to heck in a handbasket and you're like, something has gone terribly wrong. So I say if the signs are very severe, meaning the horse is like down, rolling, sweating, you know, you really can't get them brought back up or nothing you're doing is working, or if your horse has mild colic signs that are persisting past 15 to 20 minutes. We all know, and I think we can all giggle at the line about say, horses are very delicate animals, right? For being large and you know what they are. They're kind of wimpy sometimes. So if a horse has a little bit of a mild colic, I'm okay with letting them ride for 15 to 20 minutes, doing some hand walking and seeing if things are going to resolve. But if you get much past that, just call your vet. The worst call I ever get in a day is usually between the 11 p.m. and the 1 a.m. hour of, my horse has been colicking all day. Let me tell you, at that point, I'm laying in bed, I'm asleep. I open my eyes because the answering service, I have my phone set to the most obnoxious ringtone that Apple produces so that it can wake me from a sleep coma. I answer the phone, they say that. The first thing that goes in my mind is, why? If your horse is colicking, even if it's mild, I'd rather talk to you at 6 p.m. and say, great, watch him, let me know how it goes, and then we can make a plan. I urge you, your equine veterinarians, we love our jobs very much, but there are times where it's like, and that is one of those times. So just let us know. We are all very happy to make up plans. Trust me, I owned horses for 30 years. I never like to call my ER vet either. Nobody wants a vet bill, I get that. But just let us know so we can help you make a plan. Medications, obviously, and if you've had me out to your farm, I see a lot of familiar faces here. You know, I usually try to set people up with their first aid kit, and a lot of people keep anti-inflammatories in their first aid kit. That is a very appropriate first step for colic, is to give horses a single dose of anti-inflammatory. But I always tell people, if you're really not sure, if you've never given those medications before, if you have any concerns, just ask. You know, I get phone calls all the time. The horse is colicking. Can I give him a dose of Banamine? Absolutely. Have a great day. I'll talk to you in an hour. So just keep those in your toolkit, but don't be afraid to ask if it's okay. It decreases your likelihood of side effects, and there are some medications that we really shouldn't be doubling NSAIDs up with, so it's just a good check and balance for us to all make sure we're telling the correct information. Share pertinent medical history. I have had a colic before where I'm on the phone and all of a sudden they say, oh yeah, and by the way, it was on a trailer for 36 hours yesterday. You're like, could you lead with that? So if there's something that's happened in your horse's life, or if they have chronic medical conditions, just let us know. And then finally, the last 2 points kind of go together, which is safety. The worst injuries I have ever seen in my career, both to healthcare professionals and owners, is when they were trying to do something for the horse, but it wasn't safe. So you guys have probably all seen at some point a very colicky horse that is just absolutely throwing themselves to the ground and they're in their stall and they're rolling back and forth. Do not get hurt. I personally, and this is perhaps controversial for the people on Facebook later, I don't care if the horses roll. They're not going to twist their gut, and if they've already done that, they're not going to do it worse by rolling on the ground. Do not get yourself hurt trying to do something with the horses. I'd rather you say, they're in the stall and thrashing about, please just get here, and I go, yeah, please leave the horse alone. If you can, move the horse to somewhere that's safe. So big wide open spaces where they're not going to get hung up in their stall wall or an arena fence. They don't have access to food. You know, if I have people that have arenas, I'm like, just take them in the arena, let them do their thing. If you can walk them, great. If they're trying to go down, let them rest, whatever. So just be safe. So once we get there, a basic colic exam. In my world, every horse that is bad enough that you feel like you have to call me and I drive out there to see it gets 3 things. 1, a physical exam, which is just the basic exam for every animal that we touch. So listening to their heart, lungs, checking out other vital sign parameters. 2, a rectal exam. And then 3, passing a nasogastric tube. A physical exam is my job to then make sure, like I gave you that big long list in the beginning, that we're not dealing with something else. You know, no one feels goofier than going out to treat a horse for colic when in reality it was, you know, tying up or something. That's maybe a bit in the weeds. They require similar care, but you want to make sure you're treating the correct thing. A rectal exam is helpful because there are some forms of colic that even if, let's say, you call me at 10 a.m., you give the horse a dose of Banamine, by 11 a.m. they're feeling better, but I still come out to assess them. There are some forms of colic that Banamine may have treated their clinical signs and their symptoms, but it's not going to treat the underlying cause of the colic. A rectal is just like our little quick checkbox to make sure we're not missing something that may require different care. Same thing with a nasogastric tube. When I was in vet school, our professors loved to say this little tagline about passing a tube, which is 2 things. It is both diagnostic and therapeutic. So if the horses are blocking stuff up in their stomach, and we know they can't exactly propulsively vomit all of that up, then the tube allows us to remove those contents from their stomach, but it also allows us to treat them with things like fluids, electrolytes, and other stuff that we'll use for different conditions. So I check off those 3 boxes if I see any horse for a colic. Luckily, in today's day and age, you know, I have my vet truck parked out front. It looks like a giant rolling vet clinic. It's got a big box on the back. I keep lots of things in it. So there are things that we can carry with us, and depending on your practitioner, what their skill set is, what their equipment setup is, that we can do additionally on the farm to help us kind of figure out where we're going or what's going on. Number 1 is blood work. So obviously blood work that you're checking the horses like white blood cell counts or some of their kidney and liver values, those require bigger machines that we either have to take back to the clinic or send out to a different lab. But we do have some smaller handheld meters and units that we can use to kind of assess different parameters that can give us an idea of the severity. So those are convenient. The middle picture is a procedure called an abdominocentesis, or most of us just say ab tap. So the horse's abdominal cavity, and yours too if you're interested, obviously has all of the organs, but there's also a fluid that lines everything and kind of keeps stuff lubricated called abdominal fluid or peritoneal fluid. We can actually stick either a needle or a cannula or a hollow probe into the horse's abdomen and collect some of that fluid and test it for different things to make sure, like, is this changing and showing us signs that the horse's intestines are injured or dying? Are there other parameters, like there's an infectious process that horses can get in their abdomen, so we can see that the fluid has high white blood cells or things of that nature. So an ab tap is more of an advanced procedure, but it's definitely necessary in helping us make, you know, forward movement decisions about what's happening inside the horse's abdomen. And then finally, and probably the most accessible, is an abdominal ultrasound. So from the outside, we can look at what's going on the inside, and depending on how things look or what changes are happening either in that single time point or over time, we can say, all right, this is the process we're dealing with and this is what we need to do to work on it. So I will say, luckily, horses are at least somewhat predictable. Most true colics that people call me for are relating to the GI tract. Every once in a while, will I go out and catch, like I said, most common honestly is pneumonia, where I think the horse is colicking and then we find stuff in their lungs. But most of the time it's the GI tract. So who's ready to talk about the GI tract? Yeah, great. So I'll warn you, when I wrote this presentation, I was like, I don't want to get too far in the weeds, but I want you guys to have the information so that you feel like you've taken something away from this, you understand a little bit more what's happening inside. It's a little dense, so I'll try to be fun and keep it engaging. But I broke it down into kind of 5 major parts from here. So the first one is going to be understanding the GI tract anatomy. So from one end to the other, what's happening on the inside. Number 2 is understanding the word colic itself and some of the things that come along with that, and then breaking that down further into medical types of colic, surgical types of colic, and then we'll bring it home with kind of preventing some of those more common scenarios that you deal with. This is where the pictures come in if anyone gets a little squeamish. So starting off with just a basic overview. Nose to tail, right? That's where the GI tract starts and ends. So I think it's important to remember that the GI tract is not just the guts that live that people think about, but it starts just as early as the horse's mouth. So their mouth and teeth are their first step of their GI tract. It's what's in charge of breaking down the food that lays on the ground into something that their GI tract can digest. That goes down, obviously I call it the food tube, down to the stomach. That's the esophagus. Then we have the stomach, which empties into the small intestine. The small intestine is like the Cedar Point roller coaster for all the intestine, and then just as it moves through the intestines, dumps into a big finger-like projection called the cecum, which empties into the large colon, which then empties into the small colon, and then out the rectum. So that's kind of the trip we're about to go on, Miss Frizzle style. I don't know if anybody here ever watched Miss Frizzle in the Magic School Bus. I think that's what got me to vet school, in case you're wondering. So starting up first, the mouth, the esophagus, and the stomach. I loop these together because if you were here last year, you know I can give a whole hour-long presentation on the mouth, so I will not run you through that again. But causes of colic that can come from the horse's mouth: oral pain. I've had horses that have had really significant oral pathology that made them so painful they didn't want to eat. They don't eat, the GI tract slows down, now we're a little colicky. Tooth pain or a sinus infection, and then food prep. If any of you guys have geriatric horses, you know they can struggle with eating their food. And if they're struggling enough with eating their food and they're digesting or getting things down into their digestive tract that they're not meant to digest, that in itself can be a source of colic for those guys. The esophagus, everyone knows about choke, or at least I hope you do. If not, stay tuned. And so they can choke, and that in itself, they just get so distressed because they're like, I can't move anything. They will straight up colic from that. And then the stomach, obviously, Dr. Paradine gave a talk, I think 2 years ago now, on gastric ulcers, but I've had horses that have really severe gastric ulcers that can be chronically colicky. So it just seems every time around eating time, they start acting not right, they paw, they do all of that. So I don't really talk in today's talk about chronic colic, meaning horses that colic like serially over time, but there are certain potential diagnoses that are more prevalent in chronic colicers than others, and gastric ulcers are one of those things. I don't know if anybody knows this, but horses can also get gastric impactions. We think about stomach large colon impactions, but they can actually impact feed in their stomach as well. Luckily, that's very rare. We're not challenging them for any more hard things, but that can happen too, and it's important to know. The small intestine is our next stop. So this is where we kind of get into the meat and potatoes of the horse's abdomen. So the small intestine is 70 to 80 feet long. So if you imagine probably from here to the dressing room and back, that's about how long their small intestine is. It's a huge organ, and it's just a giant tube that's just floating around in there. So it can be prone to a couple of different pathologies. It's really the first step in true digestion. So this is where in the small intestine, they start absorbing some of those sugars and proteins from their feed. And so it holds a lot of food. In that entire tube, it's about this big around when it's full and kind of distended, they can hold 15 gallons of ingesta, so a lot of food. The small intestine is anchored to the body by this kind of thin membrane called the mesentery. So if you look in the picture on the right, you can see obviously this is the small intestine as it wraps around, the big kind of air balloon. And then all of this stuff in the middle here, which the screen makes it look very red, but it's usually clear and you can see through it unless the horses are very obese, and then it can have a lot of fat in it. But it contains all of the blood vessels, the lymphatic vessels that are in charge of draining all the debris. And so that's what gives the small intestine life. So obviously, if the roots of the small intestine that give it life have damage, the small intestine can die, which is a problem. So some of the things that the small intestine can get in terms of pathology, and we're going to go over a little bit more of this later. Strangulation, meaning it gets choked. So whether it gets choked off by a mass like a lipoma or a fatty mass, or sometimes the small intestine can actually flip on itself and kind of choke itself out. Again, horses, just delightful creatures that they can do this. Twists, so again, I think everybody thinks of twists in colic where essentially stuff rotates around an axis, and then at the base of the axis, if things get cut off, then they can obviously cause problems. We just talked about the mesentery, or that veil that connects everything. It can have its own issues, holes, clots, tears, anything along that fun group of things. Parasites. You've never had a living nightmare until you've passed a tube in a horse and worms come out the tube as you're holding it up to your face. And then finally, a disease called enteritis, which is essentially where the small intestine stops functioning and all of that feed material just sits. And then that's when the horses really would like to be able to vomit, but they cannot. Moving on from the small intestine, we move back to the cecum. So you'll see as part of this, I have not been in colic surgery now for about 4 years. So I texted one of my dear friends, Dr. Molly Patton at Equine Specialty Hospital, and she sent me some pictures. So this is Dr. Patton holding a cecum. So you can see there, it sticks up. People describe it like a comma shaped. So it's got a wide base, and then it kind of tapers up to a tip, which you can see there. She's in colic surgery, and the cecum can fill up with a lot of air and become quite annoying as it's flopping in your way during colic surgery. So she's using a needle to actually decompress or pull some of the air out of the cecum so that it's not this like giant, balloon that's hanging out. But the cecum itself is quite large, so you can see she's standing there. She's about 5'11" or so. It's about 4 feet long, and at the base it's about 1.5 to 2 feet around, and then obviously it tapers up to that point. So the cecum is really the horse's first stop at fermentation. So how many of you guys understand the difference between like horses having one stomach but ferment in their colon, which is like a kind of a mix of a cow and a human? Does any, a little bit of nodding here and there? Yeah. So cows ferment in their stomachs, right? They have 4 stomachs, and they have a lot of bacteria and bugs that live in there, and those bugs are actually very important for the cow's digestion. They help break down all the fibrous feed material. Horses only have one stomach, like you and I. Things come in, things go out. But they have a large colon that functions like a cow's stomach. So they have a very important group of bacteria that live in their colon, and once the horse has kind of pulled out all of the nutrients it can, it drops all that fiber off in the colon and says, good luck guys, and those little bacteria sit there and break everything down. And the bacteria are in charge of producing a lot of the horse's volatile fatty acids and amino acids that the horses can't make themselves and can't digest. So those bacteria serve a very important purpose, and there's yeast in there as well. The cecum is kind of that first stop. So the small intestine opens up in a little portal into the big cecum. Food comes in. There's varying what we call transit time, or essentially how long from that food entering the cecum, hanging out, and then leaving. Some people say anywhere from 12 hours all the way up to 48 hours. So it just kind of depends. Probably depends where that little hay particle floats to. If it gets up to the tip, it's going to take longer to get back down. It's all averages. But this is connected. The cecum kind of, as you can see, sits, the end of it with the comma sits free and can move around the abdomen, but the base is actually anchored to some of its neighbors. So, I think we as horse people sit, when we think about the horse's GI tract, we think of it like, I call it a balloon party, like the balloon animals, balloons, just sitting there floating around. There's actually quite a few attachments, both to other parts of the GI tract and to the horse's body wall, that anchor stuff in place. Otherwise, I think they'd be in a lot more trouble than they already get into. So the cecum is where some of those first big attachment points stick that kind of anchor him down to his friends. And finally, it empties into the large colon, which is going to be, yes, a question.
I'm so sorry. I don't
You're fine.
interrupt, but is the cecum always inflated like that, or is that a sign of problem?
So she asked if the cecum is always inflated like this. Great question. The answer is sometimes. So obviously a byproduct of those bacteria doing digestion is gas. I'm sure everyone here has experienced gas. So they can fill with gas like this. This is a bit abnormal, I would say. But when we listen to the horse's abdominal cavity, like when we're doing our exam, you can actually listen to the cecum and hear those gas bubbles like moving in and out. So this is a bit extreme, and obviously part of colic, which we'll talk about later, is things can fill up abnormally and get moved out of place. So this is why this is a little bit much, but yes, sometimes it can be quite inflated like that. Good question, no problem. So the cecum, just like anything else, is prone to twisting. It is prone to getting impactions. So when the feed material enters the cecum and is too firm and it can't be moved along. And then finally, blockages. There's a really fun disease young horses get where tapeworms like to sit right at the entrance of the small intestine to the cecum. And if there are so many of them that they close off the little hole, nothing can come in or out. Isn't that magical? Sometimes you work with horses and you're like, who came up with this? So finally, another question.
When you do a rectal, can you touch the cecum?
You can,
Okay.
yeah. I'll add a little note there because that's a good question. Rectal exams. She asked, when you do a rectal, can you feel the cecum? I have very long arms. Some of my coworkers have very short arms, but the reality is the rectum is about 8 to 12 inches long. So when we go in to do a rectal exam, I can pretty comfortably, and most 1,000-pound horses get to about my mid bicep or up to my shoulder. You can really only feel the back third of the abdomen, because if you think about it, even though you're entering through the rectum, you still have to bypass their pelvis and all the pelvic muscles. So by the time I get over that, I'm already to my elbow. So this is really not much real estate to get way in and start feeling some of these things. On a normal rectal exam, I can usually feel the end of both kidneys sitting up on their back. You can feel the bladder sitting right on top of the pelvic brim. I can go in and down and feel a lot of the curves, which we're going to talk about here really shortly. This is part of the large colon we can pretty routinely feel right off to the left. And then I can feel the cecum over on the right. And then depending on if there's something else going on, we'll feel other pathology. Obviously, if your horse is a mare, I can feel her uterus and both of her ovaries. But that's all the things that we can feel on a rectal. But yeah, the cecum lives right back there in the back right side of the horse's abdomen, so we can feel him. Yep.
My horse had a growth on the cecum.
Yes, those are not fun.
31 years old.
Yeah. And the tough thing, obviously, when you think about this in space, if I'm in rectally, I can really only feel that like back inside corner of the cecum. You can't, and part of it's you're restrained to the fact that you're in the horse's rectum, so you can't just like start reaching around places. But you can't like reach around to the outside. You can't reach down to the base. I mean, that's impossible to do within the constraints. So usually what happens is, and truly what I'm feeling for on like my very first visit is the cecum where it should be, and does it feel normal? So is it super gas distended? Can I palpate like a big impaction there? I use my fingertips and kind of prod around. And there's certain landmarks that I have to know for doing my job, like the cecum has so many ligaments built into it, and it has little sacculations or those nice little pockets that you see here. Same thing if you look at this large colon. The bottom part of the large colon has these saccules, the top's a little more smooth. So we can identify certain structures. Obviously, it's like a fun game you're playing, but you can identify that based on how they feel. So yes, we can feel the cecum, and it's part of a normal exam. Yep, no problem. So the large colon, I have a video later on that I think will make this make much more sense. So you kind of have to close your eyes and misfrizzle it here. So if you imagine you've just driven out of the cecum, the large colon makes up these two U-shaped loops. So there's a U-shaped loop that sits right on the bottom of the horse's abdomen. So if I'm a horse, it's on the stomach side. And then it does this fun little 180-degree turn, which is what this guy is here, called the pelvic flexure, or essentially it's the turn that the colon makes that's backed by the pelvis. So we can feel that on our rectal exam. And then it has another U-shaped curve that's between the bottom of the horse's stomach and the back. So those two U's sit right on top of each other. And this is really where the magic happens in terms of fermentation, absorption, and water absorption. So the colon here, you can see, this is, again, Dr. Patton's lovely hand pointing out the colon. So you can see we've got the colon coming down, and this colon, this horse, you guys don't necessarily need to know this, but in this horse, it was in colic surgery, and they were actually going to do something called dumping the colon, which is about as fun as you all think it is. But they have it on this fun table that actually comes out to the side. So the horse's abdomen is over here, and the colon's been pulled out so that it's on this table. Because essentially what happens is when the colon is super full like this, who wants to guess how much this weighs?
100 pounds.
Yeah, it's like 100, it can be anywhere from 100 to 200 pounds. I don't know about you guys, I hit the gym, but there is no way, and you have to imagine this horse is on a colic table, so they're on their back, their abdomen is about chest height to me. I cannot pick up a 100-pound colon, lift it, and then manipulate it and do a fun little ballet dance with a colon. So when they're super full of food like this and we need to be able to move the colon around, one of the things that the surgeons will do is actually make an incision in the colon itself, and we actually, and I have a picture of this later, remove all of the contents from the colon. It's really a delightful thing. So, yeah.
When you pull the colon out like that, and that's a live horse,
Yeah.
and you put it back, and you make these incisions, does the horse live?
Yes.
Sure.
Otherwise, we wouldn't do it.
It's just like human surgery. It's a horse.
You don't want to know what happens in human surgery.
No, I don't.
But yeah, this is a very routine procedure. We're going to, I go in after like the surgical colic stuff and talk a little bit about like outcomes and statistics. So I'll get you more
I'm
there.
surprised you could pull the organ right out and lay it down.
I know. For as delicate as they are, you can do shocking things to them.
Yeah.
Yeah.
Thank you.
You're welcome. So the colon, if in those two loops, if the horses did one thing correctly, you can see they firmly attach the loops to each other. So those two big U-shaped things are not just like free dancing in the abdomen. They're pretty well adhered to one another, and they have anchor spots to other GI tract parts as well. But this thing, if you were to stretch it out, it's about 12 feet long. I'm 6 feet tall, so two of me. It's a pretty long and large organ. On the bottom side of the organ, it's anywhere from 8 to 12 inches around, and on the top side, it's between 6 to 9. So it's a little bit smaller on that top loop, which you can see here, versus the bottom loop. And it can hold up to 20 gallons. These things, especially, one of the barns we used to service had draft horses, 200, 300 pound colons. Not fun, but they are impressive. And so this is where the majority of that fermentation happens and where those horses are really starting to take that fibrous feed material and turn it into things they need. They also turn it into everyone here's favorite thing, manure. So the colon itself can get quite a few different pathologies because it is such a large organ. There's so much that goes on. Same thing as before, twists and impactions, infarctions. So the colon, because its mesentery is a little bit smaller than the small intestines, if they throw a clot anywhere in the mesentery, the colon can be quite diseased. Displacement, so that's where I have a video for you later. So even though it is well attached, this loop here, the pelvic flexure, will sometimes, if it gets gas filled, I jokingly say it's like a balloon in a fish tank. It'll kind of float away from where it should be and get hung up somewhere else. Colitis or diarrhea, and then finally enteroliths and fecaliths, which are another magical thing that happen in horses. They can make what we call horse pearls. So on your guys' left, this is a fecolith. So essentially just fecal material that got so impacted into like a mass-like structure that it got hung up in the horse's pelvic flexure, that little U-turn, and they can't move this along. And then these guys on the right are called enteroliths, or essentially if there's a foreign material inside the horse's colon, they will, like an oyster makes a pearl, lay down a bunch of mineral around it, and so then you essentially get rocks. These enteroliths are about this big, and they are solid. Like you could make jewelry out of it probably. Again, horses are nature's greatest invention. Finally, we're almost to the end. So the small colon and the rectum. So the large colon tapers down into a much smaller colon, hence why it's called the small colon. That guy is about 4 to 6, sometimes up in the 8 inches around. But this is really the last stop for the horse's GI contents to get suctioned down into those cute little fecal balls that we all know and love and spend lots of time with. So you can see this is a picture, and obviously this small colon has a problem, but you can see it's got these really tight little what we call sacculations, or kind of the bumps that you see. So that's where it's really pulling all that water out and forming the manure down into actual fecal balls. You can see in the background here, this is the large colon again. So we've got all of our friends. It is the last 8 to 12 inches of the small colon is what we call the rectum. And that really is just where the holding facility until stuff is exited out for you all to pick up later. The small colon also has a group of things that can go wrong with it. So same thing, strangulations, infarctions or blood clots, twists. They also can get impactions, just like the large colon. Small colon impactions are much less fun than large colon impactions. And finally, in the rectum, rectal tears, and then also rectal fistula. So sometimes when mares are foaling, baby parts go where they shouldn't and can tear into the rectum and cause their own set of problems. All right. So why do we care so much about anatomy? When I was in vet school, equine anatomy is a whole semester long course where you go in lecture and then in lab dissecting. So we care because it gives us a couple of different things for both myself and then you all. For me, it means that I can help you diagnose the problem. So understanding all the parts and pieces means that I can help to kind of parse out where the problems are coming from. It can make us choose appropriate treatments. So even though we kind of have a general list of supportive care, or just basic care things we can do, certain pathologies do require different care kind of protocols than others. It gives us information on the expected progression and outcomes. So not all colics, as I'm sure a lot of you here know, are easy breezy little Banamine colics. Some of them are much more intense than that and require additional care. And then finally, it can give us the best chance of giving you an appropriate referral, or essentially, hey, what's the plan? Obviously, some forms of colic, a little more foreshadowing, we can prevent, so we'll talk about that. And then for you guys as the owner, I always tell people it does me no good to be the only person that knows what I'm doing, right? I like to share this information so that you all can understand and hopefully also have the ability to make informed decisions. I am a firm believer in that. So I try, if I'm diagnosing things on a colic, to really explain and take the time so that people understand what's going on, because one, it means that you have the knowledge and power to figure out what's best for your horse and for you. It also gives you the chance to make informed decisions regarding treatment. So some colics are not going to resolve in the field, and unfortunately it's just a reality of horses. So it gives you the chance to say, all right, this is the plan, this is what I need to do. And it also tells you kind of the likelihood that a horse is going to resolve, whether that's on the farm, in a hospital setting, or do they need to go to colic surgery. And same thing, it gives you a chance to kind of work on your prevention. Okay, the fun part. Colics, we medically group colics into one of two categories. They're either medical colics or surgical colics. Medical colics are colics that the only treatment that they truly need to get better is time and supportive care. So, certain things which I'll go into, you can deal with by just treating the horse and waiting for them to get better. Surgical colics are colics that, regardless of the best medical care you could give them, the problem will not fix unless they get colic surgery. And unfortunately for a lot of surgical colics, those problems, if they're not treated, can lead to the horse's death. So those are things that you just can't fix by giving them, IV fluids and time and all of those things. Sometimes, no one's favorite thing, medical colics can become surgical colics. So if you're kind of waiting and you're hoping that the GI tract starts doing its thing and it doesn't, then those horses need to go to colic surgery to get their kind of secondary problems resolved. And then I just put a note on here under surgical colics, which is sometimes surgical colics are treated medically because we don't have any other options. I had a horse when I was a kid. She was an Arabian. She was a nutball. I loved her. She's crazy. That horse would have never done well in colic surgery. When those horses go to colic surgery, they have a rest and rehabilitation time afterwards that has to be taken into account. I don't know about you guys, but when I was 16, 17, I was not paying for colic surgery, so that's another consideration. And then finally, some pathologies we get are not fixable, and so the best we can do is try to see if supportive care and time will fix them. But if it's not, then unfortunately the horses will force us into making other decisions. But I just put that note on there because I feel like a lot of times there's some guilt with people about making decisions about colics, and I try to remind people that they're horses. Unfortunately, we can't always do everything, and sometimes the things that we can do, we can't fix them. So just as a little aside. So I'll give you a couple examples. So these are medical colics. This is, again, there's more photos here. So everyone's favorite, the gas colic. So the gas colic is way far and above, and this is the good news of this lecture for the day, our most represented colic. So I jokingly to clients will call this the Taco Bell colic. You go eat Taco Bell, you maybe don't feel so good, you need a little time, maybe have a nap. That's what a gas colic is. So essentially, the horse's GI tract, if at any point they have gas distension, or if their GI tract kind of moves somewhere and is pushing and pulling on things, they all have nerve endings. You can't necessarily, obviously sitting here, you can't be like, I can feel my small intestine. But when your colon has gas in it, you can feel that. So these are fairly common. These are horses or donkeys that are just not feeling their greatest. They may be a little lethargic, they're off feed. Sometimes gas colics can be quite violent. So your wimpy little little 2-year-old that's never colicked in his life, and he has his baby's first gas colic, and he's like, this is death. And you're like, you just need some Banamine, calm down. But the truth about gas colics is that they should resolve, and once they resolve, the horses are completely normal. So if you give your horse a dose of Banamine, an hour later they feel great, and then 4 hours later they're colicky again, not a gas colic. So just something to point out, I love gas colics. These are the ones you call me at 2. I say call me at 3 when the Banamine's kicked in. You call me back and say, they're eating all the little hay scraps off the floor. And I say, awesome, have a great day. So these are quick and breezy colics. Also, similarly on that topic is dehydration and something we call ileus. So ileus is a medical term for when the GI tract is not moving. So the GI tract can decide not to move, again, because they're horses, at a whim, whether they're having a bad day, the moon is in the wrong phase, the sun set an hour earlier because the humans changed the clocks, whatever. But essentially, if any part of the GI tract slows down and things aren't moving through appropriately, the horses can experience some pain from that. Similarly to dehydration, if they don't have the same amount of water in their gastrointestinal tract, that can cause its own set of things. These usually resolve with very light supportive care. Obviously, dehydration, you just need to get their hydration back up, but otherwise we can usually treat them on farm. Sometimes if the ileus is severe and things are not moving, they do require more advanced medical treatment, but usually these are also pretty easy fixes. On the right, you can see that's an ultrasound image of a horse's small intestine. So that's that little donut. That is a normal looking small intestine, other than the fact that it's just I was standing there with the ultrasound probe just resting, and it was just a circle the whole time. It should kind of do this squeezing motion to move things through. So when you see that where it's just sitting there, we call that ileus. Another medical colic is enteritis. So this is my favorite topic. Horses, we all know, does anyone here have cats? Who has cats? Okay, and dogs too. We can loop dogs in this. You have the dog that is in the house, and you're like, let's go outside. You take the dog outside, you throw the ball for like 20 minutes. I used to have a red heeler. You could throw that ball for 6 hours, and she'd be on death's door, be like, I will get that ball. You take them inside. They run to the water bowl. They sit there, they drink half of the water bowl. Then they turn around and they go, bleh. Has that happened to anyone? Yeah. That is not vomiting. That is reflux. Babies do this too. If any of you have newborns or had newborns, same thing. They just sit there, ha ha ha, bleh. That's reflux. Vomiting is an act. I'm sure all of you here have experienced vomiting. You know, your abdomen contracts, your stomach contracts, and it forcefully pushes things out of your esophagus and then out of your mouth. Horses do not vomit. They cannot expel things from their stomach with a forceful contraction. They can, however, reflux. So that's what I was talking about earlier, where they started to have some of that discharge from the nose. These guys will, and if things get bad enough, they will leak stomach contents out of their nose. Typically, if people are calling me and they say the horse has been violently colicky for 4 hours and now they have green stuff, I'm like, ooh, we are not well. So enteritis is essentially the precursor to that. Now, enteritis is a different problem than horses that have a surgical lesion that stuff is backing up and then vomiting. Enteritis is truly just my small intestine is not working, things are backing up, and it needs to be out of here. So enteritis we treat by passing a nasogastric tube. You can see this person on the right has passed a tube. Normally, when we pass a tube into a horse's stomach, we either, first of all, nothing usually just comes out. Sometimes it does, but very rarely. What we do is we pump water in and attempt to siphon out some of the horse's stomach contents, but normally what we put in is what we should get out. Horses don't usually have just a ton of stuff sitting in their stomach unless they just ate a huge meal. When you're filling up the red buckets and you're trying to find someone to run and grab you another bucket to fill up like this person is, that's enteritis. So that horse has got all of this stuff that's kind of backflowed from their small intestine, it's sitting in their stomach and it's got to come out. Enteritis is the reason that they require more intense management is because just like in people, we can all relate to this, if you're vomiting a bunch, you're losing your water via your vomit. Horses, because their body is so dependent on water, just like everybody else, when they're losing all of that to that vomit that we're taking out of them, we have to replace it. So these horses often need a lot more medical management. They need IV fluids. They need nutrition given to them IV because obviously nothing's going through and being absorbed. And so these guys require a little bit of medical management. I don't like to keep these guys on the farm because historically they do not do well. They get dehydrated, then their colon says, well, if there's no water here, I think I'm going to be a problem too. You're like, great, everybody's a problem. So these guys require frequent tubings. If it is an infectious cause, so like Potomac horse fever can cause horses to reflux significantly, we treat them with antibiotics. There's a little bit more involvement with these horses than just simply passing one tube, giving them some water, and leaving for the day. These, we joke. In veterinary medicine, we measure things using one of 3 units: U.S. currency, food, and sports balls. So if you have a grapefruit size impaction, that is less problematic than a volleyball size impaction. And sometimes I've gone in and palpated impactions where I start, I told you we get kind of over the pelvis. I can feel the impaction and I can track it going this way and I can track it going that way and I can kind of get around the top of it, but I can't really feel the bottom. They can get quite large impactions. I jokingly call those the baby Jesus impactions. There are no sports balls that are that big. So if they get to that point and the horses are super painful, sometimes our only option is truly to open the colon and physically remove the impaction. So we'll manage these medically until the horses decide, no more, I can't do it. Question in the back. At one time? Luckily, she asked, can a horse develop more than one impaction? Luckily, we typically don't see that. The only time that I've seen that before is when the horse had a very large colon impaction or a small colon impaction. The GI tract slows down and then they get like one or the other. So they started with a small and now they have a large, or they started with a large and now they have a small. Does that make sense? They don't typically get impactions in more than one spot. Just because once stuff slows down there, then it just kind of keeps backing up there until we can get it softened up. No problem. Like I said, no stupid questions. What else? That's pretty much it. A lot of times these guys too, we have to take them, when we talk about on farm versus in hospital versus colic surgery, I'll manage them on farm until I can't. Then usually we'll take them into a hospital setting, IV fluids. Some of them can be so painful that like your twice a day Banamine just isn't enough. We'll manage them with sedation or other forms of pain medications like opioids that we just can't leave on farm. So it kind of depends on how the horses respond with these, but I've done all 3. I've managed horses on farm, I brought horses in the hospital, and I've taken horses to colic surgery. So I'd say the good news is more likely than not we manage them on farm, which is good for us and them. The last one is displacements. So a displacement, like I said, is a colon problem. So that colon and its buddy, its little U-shaped loops, can kind of get floated around to the wrong side of town, and then they get stuck on things because, again, horses are horses. There's a lot of ligaments that anchor things in place. So ligaments that anchor the spleen to the kidneys, ligaments that anchor the spleen to the stomach, ligaments that anchor the stomach to all sorts of things. And that colon can get sneezled around in a spot, and sometimes it just sneezels around and gets kind of sitting there and it's got some gas and it floats up to the wrong side. And sometimes they can get hooked around one of those ligaments. And again, we'll manage them medically, supportive care, IV fluids, pain control. But if that colon's not getting back to its home base, sometimes the only way to do it is to replace it surgically. I joke, these are the boring colic surgeries. You open them up, you rearrange their guts, you sew them shut, which seems very uneventful, but a lot of times it is necessary. I think in this instance, it's a lot easier to see with a video. So I found if you are very bored later, as I'm sure all of you will not be, if you go on YouTube and you look up the glass horse, there's some really cool medical illustrators that realize that this is kind of hard to picture in your head if you don't have any experience with it. So they've essentially made a see-through horse. So I'm going to play this video. And what they're going to do, there's some talking that I took away, so you can ignore the subtitles. But they're going to take away the rib cage. And you can see we've got the stomach. This is our large colon here. And then our small intestine, small colon, and rectum. So you can see they're showing that tail, or that pelvic flexure, the 180, gets kind of looped around. And then as he does, the other side of the colon that's supposed to be up against the horse's body wall gets flipped up over into their pelvis. So there's a couple of different kinds of displacement. This video is specifically for what we call a right dorsal displacement, which again, none of you have to care about. But this is essentially what happens is the colon leaves its happy home and just can't get back. Sometimes if you give these guys IV fluids, pain control, we let kind of the intestinal gas move through. Sometimes they will go back on their own, and a lot of times I'll manage them that way because no one wants to take a horse to surgery they don't have to. But sometimes if they truly get stuck, the only option is to go in and replace things. Yes, that's the glass horse if you get bored. A couple of surgical colic examples. So these are, again, ones that are not going to get fixed on their own. I think most horse owners think of all surgical colics as strangulations or kind of chokings or twists. So obviously these are fairly common and can happen for a variety of reasons. This can happen really to any part of the horse's GI tract. Luckily we don't typically see it with like the stomach, but it's very common with the small intestine, the large colon, the cecum, and the small colon. A strangulation is essentially when something cuts off the blood supply or it cuts off the actual tube itself. And essentially if it's left strangled, it can cause significant injury, and then if it's not corrected, it can cause that piece of intestine to die. And then this can happen whether by a mass, so lipomas, which I have pictures of, or when little fatty masses get wrapped around things and they kind of choke everything out. Or sometimes it can happen by other soft tissue structures, so I'm not going to bore you with the details there, but that's kind of other fun things that can happen. Twists, or the medical term is a volvulus, is essentially when either the intestine rotates around itself and cuts off its blood supply, or it rotates around its friends and cuts off all of their blood supplies. And then strangulations and twists, when we anticipate that those are happening based on our exam, the horse's comfort level, the ultrasound, some of our blood parameters, these are colics that you got to decide. Can the horse get colic surgery or not? And if the answer is or not, usually that's when I'm prepping people like, hey, this is a surgical lesion. If we can't correct it, like these are what our next steps are. But if people are saying, well, maybe I would take the horse, this is the time where we separate the maybes from the no's. Like it's either yes or no. If these are left, the intestine can die. So if something is strangled for very long, and I'll show you some pictures where I think you'll really get an appreciation of that, the intestine itself will die. Once the intestine dies, that wall that normally keeps the food in the food tube and not in the abdomen will start leaking contents of the horse's small intestine or colon or whatever into their abdomen. Eventually those bacteria get picked up by the blood supply, the horse will become septic, and then ultimately they will pass on their own. If this happens, no amount of medical care that you will do will stop that cascade from happening. A question? Great question. So she asked, if you have a horse with a strangulation, how long does it take the intestine to die? Hours to die for the intestine itself, anywhere from 8 to 12 hours for the horse to pass because of it. Because obviously,
You don't have a strangulation in like say 2 or 3 hours, then the horse will die because the intestine is.
yeah.
In other words, the timing is very critical.
Correct. The timing is very critical. One of the taglines I have later in the thing is time is intestine. So no one likes cutting into intestine and removing it. So if the horse is cared for in a short enough time frame, a lot of times you can untwist things, and if the blood supply returns, it's just an injury. But if it surpasses injury and actually gets into death, then the only way to treat that is to remove the diseased intestine, and then you have to sew the ends back together, which is sometimes possible, sometimes not. But yes, that's where time is very important for treating these. Yeah. Another question?
If you have to reset the small intestine or lipoma, how much can they do without?
Stay tuned. I'll answer your question shortly. Okay, I think the next set of slides are all the picture slides. So if you don't like it, close your eyes now. So on the left, this is an ultrasound of a horse that had small intestinal disease. So this horse ended up going to colic surgery and having part of its small intestine removed. So you can see these small intestine have just giant loops, and they've got stuff just kind of sitting in them and floating about. On the right, these are those lipomas. So you can see there's 3 of them of different sizes. We've got a small, medium, and a large. They cut the large one in half so you can see the inside. But you can see they live on these long ropes. So if you imagine, it's like an anchor. So you've got this heavy lipoma on the end that's just bebopping around the abdomen, going to see all of its friends. And that rope is wrapping around things. At some point in that horse's life, that rope could get to a point where it cuts off blood supply. So that's why those are problematic. So on the left, I think this picture is like a great picture to really understand what's happening. This, bad. This, not so bad, but still not normal. This is what intestinal death looks like. This is what surgeons think about intestinal death. We got the double thumbs down. So you can see this colon is we don't like to see purple in surgery. We like pink, red, shades of red and pink. So this purpley looking colon, that entire colon is dead. So these are when we can really see the difference when you're in colic surgery of what the intestine looks like. On the left here, this is actually, I said other soft tissue structures. So this horse, because horses are horses again, formed a connection between his large colon and the cecum that shouldn't have been there. So that little band was pulling on his friends and not letting it live where it should be and causing problems. Over on the right, this is actually a horse. She foaled like, I think 10 hours before I took this picture. And when the foal came out, it punched a big hole through her mesentery. And so the entire mesentery died, and then the entire colon died. So again, horses are fun creatures. On the left, this is your classic lipoma picture. So you can see this is a lipoma here. It choked off this section of small intestine, and so this whole loop has died. And then on the right, Dr. Patton here is showing us small colon that's got a really big injury. So you can see all the bruising. It's actually usually pretty impressive. You can see right where the problem starts and ends. So when you look at the colon, this isn't a great photo for this, but usually you can see like nice healthy colon, then boom, right, unhealthy colon. So you can see where the margins are for the problem. And again, just a shout out to Dr. Patton if she's watching. Thanks for all the pictures. Thank you, Dr. Patton. So considerations for colic surgery, finances. You know, average colic surgery is going to start at $8,000. The bigger problems they have, if things need removed, if things need opened, it only gets more expensive. I recognize that for a lot of people, that's just not an approachable number. Even with insurance, it's often, you know, you have to pay for it and insurance reimburses you, so that can make things tough. Anytime we manipulate the intestines, so this goes back to your point, it is shocking what we can do to fix problems, but anytime we have to open the horse's abdomen and move things around, especially the more you do, so if you have to cut pieces out or if you have to remove things and sew things back together, then anytime you do that, it's going to increase our likelihood of complications. Age, is it just a number? I have taken a horse to colic surgery who was 33 years old. The horse did fine. You know, we're better at caring for these older horses. I know a lot of people say like, hey, this horse has lived a nice long life. I don't want to take him to colic surgery. That's a very personal decision. But I always tell people if it's just the age you're getting hung up on, that's not a reason for me not to do it. Prognosis based on the lesion. Horses with small intestinal disease, you can really only remove about 30 to 40% of the small intestine. Otherwise, they really start struggling with digestion. Some papers will say you can take up to 50%, but I don't know a lot of surgeons that are excited about taking 50% of the horse's small intestine. The colon, and part of this is because the colon is much shorter than the small intestine, you really can take even less of the colon because it's so important. So if you open up the horse's intestine like you saw the double thumbs down, if the whole colon is dead, there's no way you can take all of that out and have a horse that can survive that. Finally, systemic health. When I worked at Rood & Riddle, we saw a lot of broodmares that were, broodmares love to get a very specific type of colic right after they foal. If those broodmares were not seen and noticed, because you know they all live out in pastures and they come in to eat and stuff, if those horses have been colicking for multiple hours and now they're very systemically sick, those horses are less likely to survive because they can't, you know, if you cut off blood supply to a huge organ and it's releasing toxins and releasing bacteria, they don't tolerate that very well. So this picture on the right is how I send all of my surgical updates to surgeons. I like to sneak my face in there so they know we're having a good time. So the good news with colic surgery is that we're not so bad at it. So there's been a couple of studies that have been released within the past couple years that have some, I think, good statistics for you to know. So between 60 to 80% of horses that undergo colic surgery survive to discharge. So that's not so bad. It really depends on how long the horse was in the ICU for, what kind of surgery they had, and what kind of complications they had. So we can even more accurately predict, like if the horse has a small intestinal lesion that required removing some intestine and they did not reflux after surgery, we're pretty good at predicting their survival rate. 96% of horses that went home were alive at a year. That's not a bad gig. And then even better, 63 to 72% of those horses resumed their level of work before colic surgery. Obviously that number is a little bit shorter and there's a lot of factors that go into that. Some people want to retire the horses. We know that certain disciplines, you know, jumping, especially a big high jumping, with a horse that has an abdominal incision, some people are like, I just don't want to risk it, and that's fine, but that's where some of those things come from. And like I said, it all ties into why they were there in the first place. So our last little section is preventing and managing colic. So we're in the home stretch. The reality is horses hate change. The picture on the right, that's my horse, that's Melvin. Melvin hates change. If the wind blows in a southerly direction when normally it blows in a northerly, Melvin will colic. So realistically, I tell people, and if you'll laugh at this pun, it'll make me feel good about myself, maintain a stable environment. Thank you. Minimize your change. You know, obviously it's tough. Again, I've had horses my whole life. You will never get the same cut of hay from your hay guy as you get the batch before, and then the first cut never looks like the third cut. It's tough to manage some of those things, but try your best. The worst thing that I think I deal with, and I can say this because I've done it myself, is like we anthropomorphize with the horses. It's gonna be cold. Melvin will be cold. I'll make him a bran mash. Melvin's never eaten bran in his life. Maybe I shouldn't make Melvin a bran mash. So if you're doing things to try to change their management, you know, change things over time. If you're getting into a cold snap and the horses, you know, as they get cold, they stop drinking, you know, coming up into the future, find ways to encourage them to drink. You know, what can you change that will help support that horse? But do it over time. Try to avoid like making these quick things. The AEP this past year, so the organization that governs equine practitioners, made a post at Christmas that said, your horse doesn't need Christmas dinner. Which was essentially like, the horses don't know these things, but like, you know, everyone wants to do things like we do and give them these special things. But of course, then you have the Christmas Eve colic. So it's like, try to keep things the same for the horses. Fresh, potable, appetizing water. Anybody here have show horses? They go different places? We travel? Yeah. Trail riders, if you like to go out to different trail campsites. Melvin's not a trail rider because he hates flies, but Melvin goes to horse shows. Melvin will not drink the water in Springfield, Ohio. Just won't. You can fill up 6 buckets. He'd be like, I'll die. And you're like, great, thank you. I used to have a trail horse that she would not drink the water south of like Canton because she's like, that has more iron in it. And you're like, you're a horse, you eat iron. She's like, I don't care, that smells like iron, I'm not drinking it. So find ways that you can entice horses to drink and keep drinking. You know, water is essential to them. It keeps their colon functioning regularly. There's a lot of products that you can find at water additives that essentially entice the horses to drink. Use them. Practice with them now, or like maybe next week when the weather's been the same for a week. You know, find what they like, and then you've got a little trick in your back pocket in case you need it. Quality hay and grain. This is a big topic, obviously, because again, most people would like quality hay and don't always get quality hay. Or maybe you board in a facility where, you know, the barn owner gets a new batch of hay in and you're not that impressed. It can be tough, and I recognize that, but finding ways that your horses can stay on something, or again, if you're providing supplemental forage, like finding ways to keep that the same. And then supplements. This is the coup de grace. So when Belinda emailed me, she's like, what are some supplements that you would like to have up that we can raffle off? And I told her, I kind of gave her my little list of things that I usually recommend, because in my world, not all supplements are created equal, but a lot of them have the same base. So most of your GI supplements are going to address pre and probiotics. So digestible, highly digestible fiber that's good for the horses that feed their little gut bacteria. And then probiotics in horses, essentially trying to supplement the bacteria that are there, that are doing the bulk of the horse's digestion. Honestly, we have kind of terrible research about probiotics. We're trying. Purina last year did the big study where they had owners submit fecal swabs to try to parse out like really what bacteria live in the horse's GI tract. But we don't know a lot. And just like humans, we can kind of guess, and we have some things we know are better than others, but we're not that far yet. I typically recommend probiotics that contain Saccharomyces cerevisiae. So that is the one. It's brewer's yeast. We know brewer's yeast is one of the more beneficial fermenters in horses' colon. So I tell people, if you want to support something, or give them a supplement to address GI tract stuff, look for Saccharomyces. And then supplements for gastric support are in a totally different kind of realm. So if you're trying to buffer for gastric acid, those are not the same as like your hind gut supplements that people talk about. Stress and good basic management. So again, good dentistry and fecal aid counts. Rule out the stupid stuff. Like, don't have your horse colic because they have a high parasite burden. In today's day and age, that should be pretty easy to address. So I tell people just good basic husbandry can do a lot of things. And finally, the big secret everyone wants to know is, how can I keep colic away for good? And you want to know what the answer is? Start looking for 4-leaf clovers. Unfortunately, there is luck in part of this, and sometimes we've all been there, we just have bad luck. You cannot physically keep the horse's GI tract where it's supposed to be, and I think even with the best care, some horses, I joke that they wake up every morning, choose homicide, suicide, or both. Some horses are just going to do it to spite us, not truly, but it's just bad luck. So if you rule out all of the things you can and give them a good environment, hopefully you're then knocking off some of those little lower percentages of things that are going to happen because of care. But sometimes, and I've never walked up to an owner and said, this horse colic because of something you did, and I don't think I will ever say those words. So I try to tell people when I'm there, so obviously it's usually a very emotional time, like don't beat yourself up, you can't predict this. I always joke with people, if you've ever had me at a colic at about 2 o'clock in the morning and the holes in the filter are big, I say, you know, if you believe in intelligent design, I have the perfect counter argument: horses. So, realistically, the takeaways from today, this is it, this is the home stretch. So when you identify colic, I beg and plead of you, all of your equine vets will love you, you'll get on the good client list, just call your vet and let them know. Again, even if it's just like a, hey, this is what's happening, this is what I'm doing, I'll let you know how things are going, just tell us. I would rather just talk to you on the phone than be 2 o'clock in the morning and be like, yes, I'll get out of bed right now. We are happy to help you come up with a treatment plan, even if it doesn't mean that we're like running out to come see your horse, but it's important just to communicate. If your horse is examined for colic, ask questions. You know, some of the things that maybe your vet can impart on you will help you change something in the future. I will also tell you, as a try to be a humble person, sometimes the answer is, I don't know. I don't know what's wrong with the horse. Their rectal's normal, their physical's normal, the tube is normal, but they're still colicking. I don't know. And that's an okay answer because horses are somewhat mysterious, and there are things that they can do to help you understand what's coming next. And sometimes we just have to kind of take things stepwise and figure out what our next step is going to be. But ask, get questions, and figure out what the plan is. Number 3 is the plan. So recognize that there are many colics that horses can get that are not going to respond to on-farm treatment. So I urge all of you, when you're driving around, going home today, in your mind think to yourself, if my horse ever needed medical care, would I be open to hospitalizing that horse? If my horse ever needed surgical care, would I be open to surgery? I tell people the best thing you can do for me is decide in your mind what your kind of guidelines are, you know, or if your horse would have colic surgery, I would spend $12,000 and that's it, not a dime more. We are happy to hear that. I want to know what your hard stops are, because that means when we're getting close or when things are happening, I can inform you better of what's going on instead of just kind of hoping that it swings one way or another. Timely identification and treatment saves intestine. So back to the comment I made. Truly, the faster you can make decisions about what's happening and the faster that you can get the horse appropriate treatment, the better the outcome is going to be. Know your horse's normals. So I think back in the back we have stethoscopes and thermometers. I will happily teach every single one of you how to do a basic physical exam on your horse, how to take a heart rate, how to take a temperature, a respiration rate, and listen to their gut sounds. If you're testing those things and kind of understanding where they lie normally, you're much better at catching when things are abnormal. So I encourage you to learn how to do those things. YouTube, another great resource, can teach you how to do a full physical exam. Control chronic diseases. Again, dental horses are the biggest thing I deal with. So my horses that really can't digest hay, I'm working on addressing that before it becomes a problem. And then finally, utilize products that are going to support your horse's overall health. And if you have gut-specific issues or things you want to address, find things that are going to support you in that way. I have a kind of passion about doing that. Some vets are like, I don't care about supplements, I don't believe in any of them. I tell you to talk to whoever you have on your care team that's going to help you make a good decision about your horse. And finally, my biggest takeaway, proper preparation prevents poor performance. So if you know what you're getting into and you know your horse and you have this plan in your mind, makes all of us do a better job at taking care of them, and hopefully things go smoother and the horses have a better outcome. So I think that's the most important part. So that was everything that I have to say on equine colic.